Hi, in this video we are going to talk about the scope of homeopathic treatment for nephrotic syndrome. Nephrotic syndrome is a complex disease of the kidney where small blood vessels are involved and which lead to altered filtration process. So there is, in simple words, there is a abnormal leakage of protein to kidneys. My name is Dr. Rajesh Shah. I am heading Force Homeopathy and we treat patients from across the world. Nephrotic syndrome is a complex disease which is not fully understood. There can be multiple causes. There could be genetic factors, immunological factors, some drug-induced nephrotic syndrome, sometimes because of malignancy, sometimes because of secondary infection and so on. The results and the scope of homeopathic treatment or any treatment depends on the cause of nephrotic syndrome in a given case. At Force, we have documented and treated over 550 cases of nephrotic syndrome over last 3 decades. It is very hard to treat nephrotic syndrome and the results with homeopathy are variable. Some cases of nephrotic syndrome, they respond quite well to homeopathy, whereby the frequency of episodes of the protein leakage, they reduce drastically after starting homeopathic medicines. Also, we have to see that the duration of every episode is short or shorter than before. We also have to see that the dependency on other medicines, especially immunosuppressant medicines like corticosteroids, they should reduce after using homeopathic medicines. So what is achieved after taking homeopathic medicines? We see improvement in terms of the reduction in the frequency of episodes. Our final target is to stop having such episodes, which is achieved in some of the cases, if not all. Most of the patients which approach us for the treatment, they are usually on the treatment with corticosteroids. Some might be receiving endoxin or cyclosporin or cyclophosphamide. And I must also share here that if the patient is not treated with immunosuppressant medicines before they start homeopathic treatment, the results are likely to be much superior and better. Once the immunosuppressant medicines, especially corticosteroids, is used for a longer time, then the response time and the scope of treatment with homeopathy reduces. This is our experience. When I say that, I must also admit that some cases are so difficult that they may require corticosteroids or such form of immunosuppressant medicines. So in our experience, most patients of nephrotic syndrome would require homeopathy as well as conventional treatment together. And this integration of both these systems of medicine will eventually help the patients of nephrotic syndrome to get better results. So this is our experience. Once we start with homeopathic treatment, then slowly we may expect that the reduction in the episodes of nephrotic syndrome. One special category where patient is not only dependent on corticosteroids but becomes resistant to cortisone or corticosteroid. That is a very difficult variety of nephrotic syndrome where even homeopathy medicines do not work as desirable as what you would expect. So as I said, it's a complex condition. The results vary from patient to patient depending on the individual background. However, in all the cases of nephrotic syndrome, homeopathy is strongly recommended because no single system of medicine can manage to tackle nephrotic syndrome in our experience. How much time does it take to treat? Well, very difficult to decide. It depends on the cases. Early cases may respond much better, but the drug-dependent, corticosteroid-dependent, corticosteroid-resistant cases may take 2 years, 3 years or even longer. We cannot predict. All in all, very systematic study and planning of the treatment is required to manage nephrotic syndrome. I hope this video will help not only the patients but also the doctors of different fraternities as well as the medical students. Thank you so much.